According to the Department of Health and CDC, which is Centers for Disease Control and Prevention, STIs are known as the hidden epidemic, and they are actually noted as an infection and not a disease. Infection being that the first step occurs when the bacteria, the virus, or the microbe that causes the disease enters the body and begins to multiply. The disease then happens when the cells of the body are damaged, which is a result of that infection. One good example would be an HIV attaching to a white blood cell, which they love to do. So, as a nurse, what is our role in preventing and treating HIV or STIs? In talking to a patient, the first step or approach is to create a non judgmental environment, and this is very important when doing assessments. They may or may not share sensitive information, but if they do, make sure you let them know and feel that you're not looking down on them despite of any activity involved in their story or in the discussion. So you may need to find out past, not you may need, you would need to find out past and present patient history, which also helps you learn more about your patients. Okay. Next is to get the family involved. Asking them who knows about the situation, and if there's none, if they are willing to share that information, so both can create a plan in reaching out and getting help for that patient. In terms of treatment, just like any other drug, it is different for every individual's condition. So a patient is informed of all the contraindications a drug may have, and one good example would be for a pregnant woman. Some drugs cannot be taken on the first trimester of pregnancy. So, or if one gets pregnant, she would have to be reevaluated. During an assessment, you may ask the patient if they are taking Viagra or Cialis, which works against some HIV drugs. So, whatever the answer of the patient would be, you then inform the provider about it. So, 2 points that is very important for an STI patient to know and understand in terms of medication use, and that is adherence and motivation. So, adherence is very important, and one has to be motivated to make sure that the drug does its job. So patients can also have counseling with the use of condoms, since partners may have different types of strains of infection. So when it comes to teens, the adolescent stage, we must remember that it is not just about physical transformation, but emotional and mental changes as well. So incorporating their language is important when communicating with them, and communicate with the parents, of course, in helping you explain to their child healthy sexual decisions. Okay. We may deal with various patients on a day-to-day basis, and some patients, in terms of this condition, may be against several testing or getting their partners tested, which is very important. So we must educate them that early detection is key. I'd like to give you some sample questions that you may ask your patient, which can lead to a successful session with the patient experiencing HIV. Okay, one would be, can you tell me what you know about HIV? Next would be, do you always use condoms? Another question may be, who is responsible for bringing the condoms in the house? Or what kind of material is your condom made of? And are they kept in a certain place? We nurses must educate that if condoms are placed in a hot temperature, they may be damaged. And never wear 2 condoms at a time, since this may cause a tear and put both parties at risk for any kind of infection. Okay, and Also, you have to probe, probe in regards to their partners. Has their partner been tested? If not, are you willing to ask your partner about that? See, this may be sensitive questions, but very important. Other patient education about condom use would be to check the expiration date, to check the packaging for holes, and do not tear the package with your teeth. As nurses, we can give contacts, websites, addresses of groups, which can further educate and support them in their current condition. We must also inform them how important it is to do counseling, screening, and diagnosis when going through this kind of condition. And as always, before administering a test, explain the procedure for administering the test and the possible results for that particular test. Thank you.